Hello everyone, my name is Sascha Hein and I'm here today to tell you about the new photographic protocol for eLAB. The new photographic protocol for eLAB is much like the old one, but there are a few differences, so let's get started. We advise to always take your eLAB photos with the patient sitting in an upright position in front of you. It is always a good idea to use retractors, and when you do, advise your patient to pull them back and up towards the ears to fully retract the vestibule. Ask the patient to bite down and then to move the mandible forward into an edge-to-edge position and with the tongue removed from the back of the teeth. As per usual, you should set your camera to an exposure time of 1/125th of a second with an aperture of 22 and a sensitivity between ISO 100 and 300 depending on your camera model. Switch off TTL and select the manual mode instead to set the flash output to full intensity, which is 1/1. Attach the matching polarized filter to your flash and grab your new white balance card to position it on center with the patient's midline. You will notice that the shooting distance is now slightly increased. Use the two lower crop marks for guidance by making sure they are fully captured and not cut off. Then take the polarized picture, which should look like this. Note that if the object of interest is not one of the two maxillary centrals, but let's say one of the laterals or canines instead, the white balance card needs to follow this position accordingly. If you want to provide your dental lab with a reflected image as well, for instance to better judge the surface texture, you must use a lateral flash with a suitable bracket-like axis, in which case the flash intensity needs to be lowered to about 1/4 intensity. Again, make sure the position of the white balance card is correct and that the two lower crop marks are fully captured. And then this is how your reflected images should look. In my next video, I will explain the features of the new white balance spray reference card and how to use it in eLAB Prime. Thanks very much for watching.